Ladies and gentlemen, welcome to today's nexMPI webinar. In view of all busy schedules, etc., we use 5 o'clock afternoon, early evening in Central European time, which is not that beneficial for at least not China and maybe also not for Southern Hemisphere either. Today we welcome Dr. Feng. And she is a researcher, associate professor at Chinese Academy of Sciences in the field of imaging. And her focus is actually on MPI, and that is exactly what we do at nexMPI as a network. Well, today's lecture webinar, Dr. Zin will elaborate on the basic principles of MPI, the standard of MPI imaging workflow in preclinical setting, and the latest progress on MPI technology. So without further ado, Zin, floor is yours. Thank you.
Thank you, and good afternoon, everyone. So I'd like to start by thanking Lila for the invitation, and it's really a pleasure to be here as a member of the nexMPI work group to talk to you about the MPI technology and share some of the latest research progress from our team. So a quick introduction.
Zin, I'm sorry, Zin, just a quick interruption. There is something going on with your microphone. You're either blowing or there is something so very annoying noise.
Oh, really?
I'm sorry, apologies.
Is it better right now?
Yes,
Yes.
yes.
Better? Okay. Okay. So my name is Feng, and I am with the Key Laboratory of Molecular Imaging at the Chinese Academy of Sciences. So first, let me just have a quick introduction of our team. So we are based at the Institute of Automation of the Chinese Academy of Sciences located in Beijing, China. And our research covers a few key areas, including magnetic particle imaging for sure, and also in vivo molecular imaging, near infrared 2 imaging, and also medical big data analysis. And the team is led by Professor Jie Tian, and we are actually a pretty big group. There are about 100 researchers and students in total in our team. And for the past, I believe, 8 to 10 years, we've really dived deep into MPI, and we work on the whole pipeline from designing and building the scanners and developing reconstruction algorithms and to exploring new biomedical applications. And as for me, myself, my main focus is on the device or scanner development and biomedical applications, and which is what I'll be sharing with you today. Okay, so here is just a quick roadmap of my talk today. I will kick things off with the very basics, just kind of explaining the principles of MPI and how the workflow actually looks, and also a brief history of the technology. And once we've covered all the fundamentals, I will go into our team's specific progress in MPI scanner development, and also I will share with you some of the preclinical applications we've been working on lately. Okay, so first thing first, I'll start with the fundamentals. So what exactly is MPI? I know many of you are probably already familiar with it, but just in case we have some newcomers joining us today, let's start with a quick refresher. The concept of MPI was actually born about 20 years ago, and thanks to the two German scientists, and their great groundbreaking work was first published in this Nature paper back in 2005. And if you look at the photo in the middle, you can see the two of them standing in front of their very first MPI prototype. And then fast forward to 2016, they were actually honored with the European Inventor Award for this invention. Okay. And so how does MPI actually work? So first of all, unlike CT or MRI, which look at the body's anatomical structure, MPI is a tracer-based technology, and in that sense is actually more like positron emission tomography or just PET imaging. And the star of the show here is just this super paramagnetic iron oxide nanoparticles or spiles. And they're very tiny, usually about 10 to 40 nanometers, which gives them great biocompatibility and lets them move easily within the tissues. And now the magic happens when we apply an oscillating magnetic field, and these particles react with a nonlinear magnetization response. And then if you look at the figure here, you will see actually the signal from the particles doesn't just follow the drive frequency, is actually packed with all the higher harmonics. And we like to call this the fingerprint of the particles. And because it is very unique, and this is what allows us to pick up their signal very clearly. And what's really cool is also how versatile these nanoparticles are. We can just use the plain particles, and we can do things like blood flow imaging, or like brain perfusion imaging, or cell tracking. But we can actually also functionalize the surface of the spiles, basically just by dressing them up with specific coatings like antibodies or peptides or some other molecules, so that we can make them to target specific molecules or tumor cells within our body. And that's what I will show you with some examples in a bit. Okay, so we know that only having the signal, well, having the signal is a good start, but it's not enough to create an image. So we need to know exactly where the signal is coming from. So how do we achieve spatial location in MPI? And this secret lies in what we call a selection field or gradient field. We usually use magnets to create an inhomogeneous magnetic field that produces a very specific sweet spot called the field-free region, or FFR. And depending on the hardware design, this FFR can be a single point, which we call FFP, or a line, which we call FFL. And here's the very clever part. Outside this region, the magnetic field is so strong that all the nanoparticles, all the spiles are saturated, so they're actually blocked and cannot send out any signal. But inside the field-free region, this field, the field is near zero, so particles are free to rotate and respond to our drive field within this region. And then by applying a oscillating drive field, we can move this FFR very quickly across the entire field of view. And it's just like using a spotlight to scan a dark room, and we only pick up the signal from where the light is hitting at the exact moment. And then by the end of the scan, we can reconstruct the full distribution of the particles. And once we've collected all the raw signals, the next big challenge is image reconstruction. So basically turning those voltage signals into a picture. And in MPI, there are two main ways to do this. First is system matrix approach, and another one is the X-base approach. So let's start with the system matrix approach. And because the magnetic environment and how nanoparticles behave are very complex, so it's really hard to create a perfect mathematical model. So the most accurate way we found is just actually just to measure it. What we can do is we use a robot to move a tiny delta sample or a point-like sample to every position within the field of view and then record the response. It's a bit like mapping out the system's behavior. And then we use some matrix inversion techniques like SVD or some other techniques to solve for the final image. And then on the other hand, for the X-based approach, and this one is a more direct way of thinking. We can imagine a one-dimensional sample as shown here in the A figure. As our sweet spot or the FFP zooms across the particle, the magnetic moment changes non-linearly. And as you can see in figure B here, so our receive coil pick up this signal as a voltage. And then to get the image, we just need a two-step process. We first compensate for the velocity of the field free point and then map the signal back to the FFP's instantaneous position. And this gives us what we call a native MPI image. And now actually there has been a lot of research from different teams on working on both of these approach and everything from like boosting the speed of system matrix reconstruction to like handling the relaxation effect in X space. And because today's talk is, I think it's just intended to be a more comprehensive overview of the entire technology, so I won't go into too much details into the specifics ones. Okay, so now that we've walked through the basics of signal acquisition, spatial encoding, and reconstruction, oftentimes I get a question from the students, is MPI just a new type of MR technology? So the answer is definitely no. Although like both of the technique has a word magnetic in the name, actually MPI and MRI are fundamentally different in their physical principles, and they require entirely different hardware systems. And in this slice, we have a comparison table that highlights the fundamental differences between these two modalities. First, we can look at the signals. MRI relies on the resonance of hydrogen protons in our body and using megahertz radio frequency pulses for excitation. And MPI, on the other hand, detects the magnetization of the spiles, and that is driven by the kilohertz oscillating magnetic fields. And also, there's a major difference in the hardware. For MRI, we know that we need a highly homogeneous static field to align the protons. We can have 3T scanner or 7T scanners and even higher field scanners. But for MPI, the main field is actually a spatial gradient field designed to create that field-free region that we mentioned earlier. And because of these distinct requirements, the two systems are built completely different. And also one of the most striking differences is the background. While MRI provides excellent anatomical details, it has a high background signal because there's water everywhere in our body. But MPI by contrast, has zero background because there are no naturally occurring magnetic particles in our body. So we only see the tracer in our image. So this results in a very high contrast hotspot image, more like the PET image, but without any ionizing radiation. So this slide kind of summarize the key advantage of MPI. So the most standout feature of MPI, I think, is sensitivity. So to put it into perspective, the magnetic moment of spiles is 8 orders of magnitude higher than that of a hydrogen proton we use in MRI. And because of this massive signal difference, MPI can detect and image tracers at very low concentrations. And this makes it incredibly valuable for in vivo molecular imaging, and also for applications like cell tracking, where we need to follow a small number of labeled cells within the body, and also in tumor biomarker imaging, where we need to image a biomarker at very low concentration. And this slide places MPI in the context of other establishing imaging modalities, or mostly in vivo imaging modalities. And let's take a look at where it fits. So for optical imaging, like fluorescence and bioluminescence, it is stable in basic biology research. And however, optical imaging is severely limited by the penetration depth because the optical photons just can't travel very far through the biological tissue. And that's why deep body imaging can be nearly impossible with optical imaging. And then for MRI, as we know, it provides unparalleled anatomical structure of our body, but its sensitivity is actually relatively low, typically in the millimolar range. And then we have nuclear imaging, PET or SPECT, which has excellent sensitivity and no penetration depth limit. But PET comes with ionizing radiation and also comparatively lower spatial resolution. And also the signal decays over time due to the half-life of the isotopes, which is also a significant drawback for long-term studies or longitudinal imaging studies. And MPI here effectively bridges these gaps. It offers the perfect combination of deep tissue penetration and also high sensitivity and zero radiation. And this makes it ideal for like a lot of applications. And in this slides, we show a standard workflow of MPI. And this workflow, I would say, is a truly multidisciplinary process involving chemistry, biology, physics, and also mathematics. So it starts with the chemistry and biology because MPI is a tracer-based modality. So the spiles are very important. And we need the help from chemists to help us to design the spile probes to make it to target different biomolecules or different cells. And then once we have those probes, we typically administer these probes via intravenous injection, but for some specific applications, they can also be delivered through inhalation or just local injection. And once the spiles or the probes enter the body, they circulate in the bloodstream or bind to target cells or tissues. And then comes the physics. The subject is placed in the MPI scanner where we use the gradient field to create a field-free point and scan the object to capture the magnetic signals. And finally, through the mathematical reconstruction, we transform the raw voltage signal into a high-resolution 3D quantitative image. And as you can see in this example, this is an image, a 3D image of a vascular plaque. And we can see here, of course, this is co-registered with a CT image, but from the MPI image, we can see the surrounding tissue has zero signal. So we can get a very high signal to background ratio image. And what's also very important is that because MPI has no depth limit, so we can have whole body imaging, meaning that we can image like just the probes deep inside the body. And also the signal intensity is also linearly proportional to the concentration of the spiles. And this makes MPI also very powerful for quantitative imaging. So now let's look at the current landscape and some future trends for MPI hardware or MPI scanners. Ever since the principle of MPI was proposed in 2005, several research teams around the globe have been dedicated to developing and refining these systems. And currently, small animal MPI have been increasingly mature, and we already have commercialized scanners from Booker and Magnetic Insight. And at the same time, many top-tier academic institutions like UC Berkeley from US and this Gwangju Institute of Science and Technology from Korea, and also many other groups in Germany have developed their own high-performance in-house systems for preclinical research. But I think the most exciting development we're seeing right now is the leap from small animal imaging to human scale imaging. And the major trend here is moving toward localized human imaging. And researchers now are focusing on specialized systems, for example, for brain imaging. We see one at MGH, another at Hamburg University. And also for imaging of lower limbs, we have this interventional MPI developed at University of Würzburg, and also breast imaging scanner. This one developed by MGH, and we think this will be very useful for intraoperative imaging. So this transition, we think, marks the beginning of MPI's clinical translation, bringing this new technology closer to real-world patient care. And here are the biomedical applications of MPI. So in oncology, MPI is being used for both tumor imaging and magnetic hypothermia. So many teams has done that. And our team also has designed several targeted probes for tumor molecular imaging, and we will show that later. And also brain perfusion imaging, we think, is another key direction of MPI, showing great clinical value in identifying and assessing strokes. And also we can use MPI to track the gastrointestinal bleeding with very high sensitivity. And also, I think cell tracking is a very promising area for MPI because it has zero background hotspot signal. So using MPI, we can use that to track different kind of therapeutic cells, including macrophages, CAR T cells, and also stem cells in vivo. And also for lung imaging or pulmonary imaging is also an area of interest. Well, this study was done by Professor Connolly at UC Berkeley, and they first proposed using MPI for lung ventilation imaging. And then our team actually later on reported a new method to image the lung vascular injury. And we will also cover that later. Okay, and now I'd like to walk you through our team's development journey and the progress that we've made in the field of MPI. So our team actually has a background in optical imaging, in vivo optical imaging and optical tomography. And around 2016 or 2017, we realized the transformative potential of MPI, and then we began our transition into this field. And of course, we started from the ground up, beginning with the development of MPIs, or magnetic particle spectrometer. And then building on that foundation, we progressively scaled up our hardware capabilities. We first successfully developed a 2D MPI system, and then followed by a fully functional 3D small animal MPI scanner. And this one I'm showing here is with the FFL design, and we have a couple other scanners with the FFP scan. And most recently, we have pushed the boundary further by developing a 3D primate head imaging system. For this system, we have a bore diameter of around 19 centimeters. And then moving forward, our primary goal is the clinical translation of this technology. So we're currently focusing on developing systems tailored for clinical use, including the handheld system that we're showing here. And we're also developing another single-sided device designed for localized imaging of specific body parts. Well, hardware is important and software is also very important. So alongside our hardware development, we have also focused on creating a robust suite of reconstruction algorithms. And as mentioned earlier, measuring the system matrix is actually incredibly labor intensive, and the resulting data is massive, which creates a significant computational burden for us. And to solve this problem, our team has also developed AI-based reconstruction algorithms, and using deep learning, we can kind of implement model-based reconstruction and sparse sampling. And this allows us to significantly reduce the required measurement time and data volume while maintaining high image resolution. And also, our group has developed a proprietary modeling suite that covers the entire image formation pipeline. And also, we have curated a massive data platform with over 50,000 standardized data sets. And our database is open access to scholars and researchers worldwide. So if any of you are interested, you're more than welcome to visit our website down here, and you can download the data sets for your own studies. Okay, so now let's dive into our preclinical research across various disease models, and these applications are made possible by the flexible surface functionalization of the spiles, the magnetic nanoparticles. And by synthesizing these functional particles, and we can ensure the particles can target specific lesion areas in enabling high performance molecular imaging of the diseases. So our team has explored a wide spectrum of applications, including the tumor molecular imaging in vivo, and also the in vivo assessment of cardiovascular plaques, pulmonary imaging, cell tracking, and also brain imaging or cerebral perfusion imaging. So first, let's look at our work in oncology. In tumor tissues, vascular permeability is significantly increased, causing magnetic particles to leak out and accumulate in the tumor. And this is a phenomenon widely known as the EPR effect, or enhanced permeability and retention effect. So leveraging this mechanism and also further modifying the particle surface with targeting ligands, such as peptides or antibodies, we can actually achieve molecularly specific imaging of biomarkers on the surface of tumor cells. So in this slide, this is an example of breast cancer imaging. And in this study, we designed a magnetic nanoparticle or nanoprobe targeting PD-L1, which is a pivotal target for cancer immunotherapy, and also a key indicator for treatment efficacy. So with this particle, nMPI imaging, we can observe and quantify the probe signal at the tumor site, and using the signal to evaluate PD-L1 expression levels. And our results showed that the expression levels measured using in vivo MPI were highly consistent with ex vivo Western blot and PCR results. And we believe this is highly significant for guiding immunotherapy, as it provides a non-invasive way to screen patients and also monitor the treatment responses. And here is another example of our work in tumor imaging. So for this study, we focus on the gastric cancer. And in this study, we targeted a crucial therapeutic biomarker, Claudin 18.2. So we first, again, for the tracers, we screened and synthesized a high affinity peptide specific to Claudin 18.2, and then functionalize it onto the surface of our nanoparticles. And in our gastric cancer animal models, we just injected this targeted probe and performed MPI imaging in vivo. And our results showed that MPI could effectively visualize tumors with high Claudin 18.2 expression. And in this study, besides MPI imaging, we also did the magnetic hypothermia in this project. We use MPI to localize the tumor, and then once we see the signal, we immediately apply the magnetic hypothermia for image-guided tumor therapy. And this integrated, we call it theranostic approach, combining diagnosis with treatment, and also highlights the versatility of the MPI platform. And here, let's look at our application in vascular imaging. In this study, we performed molecular imaging of atherosclerotic plaques, focusing a very classic inflammatory biomarker called MPO. And this is an enzyme secreted by activated macrophages. And to target MPO, we actually use it's not a new tracer design. Actually, we used a design that has been published earlier in MR studies. To target MPO, we can functionalize the surface with SPIO with serotonin. And as we can see from the electron microscopy image in here, these serotonin functionalized particles actually undergo aggregation, specifically in the presence of MPO. And using this probe, we conducted MPI imaging in the atherosclerotic mouse models, and our results show that MPI can accurately localize the plaques both in vivo and ex vivo. And also by quantifying the signal intensity, we can also evaluate the inflammatory status of the plaque, which directly reflects its vulnerability. And we believe this work also established a robust imaging method for in vivo assessment of plaque inflammation. And then using the same probe, we also applied MPI imaging to another study involving a novel lipid-lowering therapy. And here in this study, we used MPI to monitor the reversal of plaques throughout the entire treatment process. And in the conventional research or animal research, actually the gold standards for evaluating the plaque size is ex vivo oil rattle staining, this bottom row here. But this method is invasive and it only gives you a single snapshot in time. But with MPI, we can perform non-invasive in vivo quantification of the plaque signal. And this not only reflects the plaque size, but also its inflammatory status over time. And our results show that the in vivo MPI quantification result was highly consistent with the ex vivo oil rattle staining results. So this study further validates MPI as a powerful tool for the in vivo assessment of plaque and also for the longitudinal tracking of therapeutic efficacy. And while all the previous studies were all based on exogenous probes, we also made a discovery in another vascular study that is there's actually endogenous MPI signal exist within plaques that have undergone recurrent hemorrhage. And our analysis revealed that this natural signal originates from henocytosine, which is formed during the degradation and aggregation of hemoglobin after a bleed. And we successfully detected these signals in both mouse model and a human carotid artery specimens. And although the signal is quite weak, very, very, very weak, it is still detectable by MPI. And this provides a completely new approach that is label-free MPI imaging for plaques. And because it requires no spinal injection, so this application, we believe, has a much faster path towards clinical translation. And moving on, we plan to use the handheld scanners to further advance this work in clinical settings. And then since MPI signal are unaffected by the tissue-air interfaces, we believe it is very unique and is very well suited for pulmonary imaging, for lung imaging, where other traditional modalities like MR or ultrasound often struggle. So in this work, we utilize the physical extravasation of spinal particles in the region with increased pulmonary vascular permeability. And this allows us to non-invasively assess vascular integrity in the lungs. We tested this in both acute lung injury and pulmonary fibrosis mouse models, and the results were very good. Our in vivo MPI quantification of the leaked particles showed a good correlation with the gold standard method, which is the Evans blue staining, to assess the leakage ex vivo. And more importantly, actually using the 3D tomography imaging, we could visualize the spatial heterogeneity of vascular permeability changes throughout the lungs. And this provides also insights into the localized vascular damage associated with different lung diseases. So overall, this study also validates the feasibility and practical value of MPI as a powerful tool for pulmonary imaging. And in addition to vascular imaging, tumor imaging, and pulmonary imaging, we've also conducted some research in cell tracking. And this slide highlights our recent work on monitoring stem cell therapy for colitis, or the inflammatory bowel disease. And the workflow for MPI cell tracking is very straightforward. The target cells are just labeled with the spiles through co-incubation. And after the labeled cells are reinfused into the body, we can use MPI to dynamically monitor their distribution and metabolic fate in vivo. And in stem cells therapy, actually, one of the critical challenges is that how we can choose the optimal route of administration. And it was previously difficult to observe which delivery method best allows cells to reach the target site. So in this study, we compared 3 different administration route. One is intravenous injection, another one is the intrarectal injection, and the third one is the intraperitoneal injection. And our finding revealed that actually intraperitoneal, or IP injection, was the most effective at enabling the cells to migrate and accumulate at the site of inflammation. And this, we believe, also provides a crucial visual rationale for selecting the delivery route in clinical applications. And beyond stem cells, we have also explored like CAR T cells, CAR T cell tracking, and also CAR NK cell tracking, and further demonstrating the value of MPI in the field of cell-based therapies. Finally, we have also conducted significant research in brain imaging, while several other teams are exploring this field. In our work focuses on brain perfusion imaging to evaluate the occurrence and progression of ischemic stroke. And in this study, we choose a unique animal model, the tree shrew. And tree shrews are actually an emerging model in neuroscience because they are very small in size, but are also non-human primates, and their vascular structure is much more similar to that of primates and humans than traditional rodent models. And in this study here, we used a photothrombotic method to induce ischemic stroke in these models. And through MPI, with the perfusion imaging, we were able to rapidly observe the reduction in brain perfusion immediately after the stroke. And this allows for a more precise or quantitative evaluation of ischemia and perfusion changes. And we believe this complements the structural information provided by MR. And currently, actually, many leading groups in US and in Germany are also developing functional brain imaging techniques based on the cerebral blood flow. So we believe that brain imaging, or functional MPI, will also be one of the most important future directions for MPI technology. Okay, so I believe the examples that I've shared today already illustrate the great value of MPI across a wide range of disease and applications. And to summarize, we think the development of the MPI field is being driven by two parallel engines. One is the technical innovation, and another one is tracer advancement. And as we achieve higher sensitivity, larger field of view, and better resolution, alongside more specific probes, MPI will become even more versatile in both research and medicine. And with the foundation of these preclinical work, we believe the feasibility of clinical translation is now within our reach. And we believe the key priorities for moving MPI into clinic will be the development of human scale scanners and also highly biocompatible tracers or spiles, and also a focus on solving unmet clinical needs. So to conclude, we have demonstrated that MPI is far more than just another imaging modality. By combining high performance instrumentation with innovative probe design, we have successfully addressed some critical diagnostic challenges, from the early detection of stroke to the tumor molecular imaging and to real-time tracking of cell therapy. So we are very happy that our results most of the times aligns very well with the gold standard pathology or ex vivo examinations, providing that MPI can really provide quantification where other methods are only like qualitative. And we believe the MPI platform will pave the way for future precision molecular imaging, and moving us one step closer to precision medicine.
Thank you very much for your
you.
presentation. Thank you so much. Wonderful. It's amazingly clear and at the same time impressive gathering of the work on your side.